So there's been a lot of free-flowing cannabis and pregnancy is great conversation. And I always dial back and I look at it from a pharmaceutical perspective because I'm a pharmacist. So I guess that makes sense. But I equate cannabis the same way that I look at antidepressants or antipsychotics or anti-seizure medications. And so first of all, we don't study medication in pregnant women. That's a bad idea. So just so everyone is aware, that's not done. So what usually happens is we look back at mothers who admit to using certain things, and that's how they sort of figure out how to classify pregnancy categories. And then they'll also do animal studies to show if they show birth defect issues in animals. And so each drug gets a class of risk in pregnancy, right? So when we talk about medications, it's always a risk versus benefit. So the risk to the mother versus the benefit, the risk to the baby versus the benefit. So if you have a mother who is on an antidepressant and has like an anxiety panic disorder, right? And you take her off that medication and she starts having panic attacks, that's going to decrease oxygen to the baby. That's going to put the mother at risk. We don't want that. Right. So we'd probably keep her on the medication. We'd choose the safest one within that class, but we keep her on that medication. Now, if we have someone that like takes Xanax before they fly, and they're pregnant, we're going to tell them to suck it up, right? It's because it's not worth the risk. The benefit is not worth the risk. So I look at cannabis exactly the same way. If I have a mother who has hyperemesis, who's vomiting to the point that she has to be in the hospital on an IV, let's use some cannabis and see if we can get her out of the hospital and back functioning, right? If I have a mom who has regular morning sickness, not so much. And then we're always going to err higher on the side of CBD, the lowest THC we can to minimize the risk, but it's not a free-for-all, safe-for-all. It's not been shown to be teratogenic, so that means there hasn't been any birth defects shown.
Not like thalidomide or some of the other drugs. I've heard doctors compare cannabis and pregnancy to thalidomide. So I was going to,
And the other, interestingly, there are a lot of studies on this, and initially they were showing a lot of low birth weight and low head circumference, which are just like poor outcomes for babies. Right. And then these researchers went back and looked at all those studies again and adjusted for tobacco smoke, because a lot of these mothers that were consuming cannabis were also smoking cigarettes. And we know that tobacco smoke causes those two things. Babies. So when they took that out, no adverse outcomes from cannabis.
So babies with small heads were born from that outcome?
It was because of the nicotine or the tobacco.
So that's the thing. They were trying to say it was the cannabis. But when they went back and they were like, actually, they were smoking cigarettes. Let's remove that data. Everything came out fine in the cannabis infants. So
it was tobacco, not cannabis.
Yeah. So what we don't know is later in life, the outcomes for those kids. And there have been studies in Jamaica that have shown the children actually came out with better outcomes. And there have been studies that show the exact opposite. But the answer is we don't really know. So we want to minimize the risk.
Yeah.
That's my take.